If you note anything, members, could you declare it? I have a declaration of interest to make, and that is I have a family member who receives care from Radis, but I've checked with the monitoring officer and it is a personal interest and not prejudicial in any way. So I clearly won't be discussing it this morning. Thank you. We have no items that I'm aware of for the public open forum element of our agenda. And so could I invite Julie and Eve to give us a brief overview of item 4 on domiciliary care. Thank you.
Thank you, Frances. So the purpose of this report is to give Select an overview of some of the issues and some of the developments in adult services with regard specifically to domiciliary care. We hope to inform the committee of the current situation and also the actions that we're taking to try and mitigate some of the problems that we have, and for the committee to use this information to scrutinise our progress and the performance. So the key issues that we have in domiciliary care in Monmouthshire is also a recognised challenge across the whole of the UK. And Wales specifically are working on a variety of strategies to try and improve the situation. Members might know of a recruitment campaign called We Care, whereby looking at developing a registered workforce that recognises the value of the roles within the care sector, but also offers opportunities for career pathways, etc. Monmouthshire has specific challenges. A lot of those are due to the rurality of the county, the demographics. This is particularly problematic at the moment in central areas of Monmouthshire, so Monmouth, Raglan, Usk areas, and also in the south, Chepstow and Caldicot. We have an ageing population in Monmouthshire. Some of the statistics are there in the report. We also know that there's statistics around the expected increase in care that's going to be needed across Wales, but also the problems in how the workforce is going to meet that demand due to the demographics of those age groups. We know for certain that in our areas of home care in Monmouthshire that we have an ageing workforce ourselves. Adult Services has been working on a model turning the world upside down. This has been developed and implemented over the last couple of years, and we are aiming to start rollout of this programme in April 2020. There's a lot of work going on at the moment around the logistics of the patches and what that will look like. At the moment, the outstanding hours that we currently have across the piece is over 900 per week, which is obviously quite a difficult situation and challenging for all the areas. Obviously, that figure varies literally on an hour-to-hour and a day-to-day basis, but there are approximately 250 hours are related to people leaving hospital, and another 250 are people waiting to be moved from reablement into longer-term care. So those are people that have come into reablement, that might be from the community or from the hospital. They've had a programme of reablement, and it's been identified that they need some longer-term intervention after that period of reablement, and we haven't been able to source that longer-term. So the reablement teams then have to stay with that person, which then obviously reduces the number of people that can get in and access reablement. We do get reports on where we're up to. The information that we have at the moment is from the end of August. The graphs that you have in the report is what we collect formally. However, we do know on a regular basis what our outstanding hours are. So appendices in the report, Turning the World, and some of the benefits that we hope to achieve from this model. Traditional models of care have been based on a very transactional way of working, you know, meeting people's personal care needs, helping them with eating, meal preparation, etc., etc. But these don't always necessarily contribute to an individual's health and well-being. And not only the individual's health and well-being, but the health and well-being of their family, community, carers, etc. Because we're not just talking about the service user here. We have a huge amount of people who are carers for their own loved ones in partnership with ourselves. The new model is predicated on building meaningful relationships. The purpose is to design a genuinely... That's all right? That's all right. And all right. The purpose of the model is to be a co-produced model of support which looks at better outcomes for individuals and what matters to them. We're developing 12 patches, which includes carer development, patch development. These patches will include our in-house home care services, but also the independent providers. There'll be regular evaluation of the patches to look at how things are going, utilising a common measurement system. That measurement system, again, will be based on people's well-being and outcome, as opposed to transactional, how many hours, etc. We're developing relationships between all stakeholders within the patch, so that's our services, our own therapists, social workers, etc., our own in-house providers, our commission providers, the independent sector, and also the third sector, and some of the community connectors, etc., who are all part of that rich sort of infrastructure of the patches that we're aiming to achieve. We're working now looking at the content of care plans, how they're generated. So again, moving away from that, going in 3 times a day to do A, B, C, but more about what's important to somebody. Obviously, A, B, and C is still important, but it's about that bigger picture. And we're looking at care plans that we can hopefully develop and then use the IT system so that we can enable our independent providers to have access to that same information, so it is truly shared. The model proposes to look at predictable payments by patch dependent on the demographics of the patch and the rurality. And it also aspires to work in a way that fits with the Social Services and Wellbeing Act. So the model is, as I've said, based on place-based way of working, wrapping services around a defined community from a very whole system perspective. And we hope to improve the experience for people receiving services, for families and community, but also maybe even as equal importance, that it improves the experience and the job satisfaction for people delivering care, so that it gains the reputation of being, great services to work in, that people are able to provide the sort of services that they want to, that they don't feel like they're dashing in and dashing out, and that they have the time and capacity to do a job that's completely fulfilling. Thank you.
Roger.
Thank you, Chair. Can you explain to me, and more importantly, the audience that might be looking in, exactly what outstanding hours exceed 900 per week? Exactly what does that mean? Does that mean that 900 hours of non-contact with people? Can you tell me easily what that means, please?
Yes, basically it means that we've been out and assessed people, and it's been determined that they need some support, and then we go out to try and find that support, and we can't get it, and at this moment in time that is 900 hours per week. So that means that there are 30, 40 people for whom we cannot at this moment in time get a care package. That doesn't mean to say that they are home alone with no help. It might mean that they are in hospital waiting. Like I said before, they're in reablement and we can't move them on, or we are doing a care package that's not as good as it ought to be or needs to be, or we're relying on families and carers to provide some of that support as well.
Councillor Brown.
Yeah, you went through the 900 hours when you were talking, and you explained 2 lots of the 250 hours, but that still leaves the, from my calculation, 400 hours. And when we looked at the budget report, we said that it was obviously that has to be updated, but it said that there was 309 hours outstanding, and obviously this has gone up since, but we haven't got any explanation of from my maths where the 400 hours are and what actually that relates to. Thank you.
Eve, do you want to respond to that now, or do you want to respond later? Entirely up to you.
I'm happy to respond now.
Thank you.
Predominantly, those will be people that have been assessed in the community. So we talk about the most urgent ones being people who need to get out of hospital, and also those that we need to move on from reablement, because it's absolutely vital that we can move people into reablement. So the outstanding hours will be those that have been assessed in the community as needing some support, that we're unable to meet that need in its entirety at the moment. Obviously, if there's a crisis, then we will have had some intervention one way or another. Thank you.
Good morning, Eve. How prepared are you now for the winter with challenging things like my ward had terrible flooding in Skenthriff? We could have the beast from the east again, and as you're saying, there's more demand, but the rurality, especially in my ward, how prepared are you, and would there be the occasion where you might think that you'd have to move somebody into some sort of care for safety because they could be vulnerable if nobody can get to them? And also in lots of patches in my area, patches being a different meaning, that you cannot get any mobile signal and things like that. So, have we got the resources or even the vehicles to get to some of these people that are going to be dependent on help?
I will answer yes, as much as it's possible to say yes, Councillor Edwards. We have a very robust winter plan. We have 4x4 vehicles at all of the hubs. We have staff who are trained. We have a protocol for bad weather. We work very much in collaboration with all the other services in the incidence of bad weather. So each of the areas has a list of the people that we go out to see and who are the most vulnerable, so who are the priorities. We work in conjunction then with the independent sector. There have been many occasions where we've shared runs. We work with our own district nurses, etc., so we double up runs that way. We have what we call our foot soldiers, who then go to the more town areas, and then we have our rural patches. But like I say, staff are trained in how to drive, etc., in those conditions. We also then have our links with other areas, like the police that work in the rural areas. We're in contact with them if there's any sort of hard to reach people that we just aren't able to get to. And obviously there are times where we have to draw the line depending on the safety of our own staff.
Thank you, Chairman. I wonder if you could just explain to me this term patches. I'm not terribly familiar with that, and I'd like to understand a little bit more about what a patch is and how many patches there are, etc. If you could, that'd be helpful.
What we've done is we've looked at, it's been a big piece of work where we've looked at population, demographics, rurality, and we have sort of 3 predominant areas at the moment. And I suppose what we've tried to do is subdivide those into smaller areas, so that we will then have a patch which will have, so there are 12 patches across the area, and the hub will still be almost like the central base. But in each of the patches then there'll be designated services that will deliver to that patch, so that I suppose the overarching principle is that they then become part of that community, working with the community and not just to the community. There's always been a tendency, often because of the way systems have been set up, that things happen more randomly. So we need some care over here, who can deliver it? Whereas this is about being much more coordinated, which then enables us to be more person-centred. Also, it's predicated then on patches will have different payments to accommodate their rurality, etc. So obviously, it's easier to deliver care in Abergavenny town than it is in Skenfrith. So the price or what we pay needs to be relative and reflect that. Does that answer the question? Or do you want to add anything to that, Julie?
I did, and now I've forgotten. I will add. I think Eve mentioned this in the beginning. This piece of work has been, in a sense, this turning of this world has taken quite some time. We have been on this journey now for 3 and a bit years. And part of that, in conjunction with our partners, has been working it out. So actually working out, I think it's quite easy, isn't it, to say we've got 12 patches. The detail that people like Tyrone sat behind and Gary and our 2 commissioners, Shelley and Kerry, have put into this is phenomenal, to actually get to a level of detail per patch about what is predictable. So they've used information based on the last four plus years to analyse what's been the demand, and therefore what might the likely demand be when you overlay, as Eve has said, the demographics that we know are coming or are on us now, and that population growth or shrinkage, whichever, plus, like we say, the rural issues. So it's been a very sophisticated piece of work, but I think when we get there, it's going to enable us to have much more sustainability. So at the moment, we're saying we've got this deficit in hours, and that's quite, when I say it's unprecedented, it's been growing for a number of years now, and it particularly gets bad at this time of year, but actually it's been a feature all year this year. But I think the relationships that we have with our providers and our in-house have with our providers as well enables us to really maximise the most out of that. And when we move to this patch approach, I think that's going to give us much more flexibility and allow us much more opportunity on a patch basis to work together. Eve mentioned, and some authorities, I don't like the way that this happens, but some authorities, you ring in and you say you need some care, and you will be delivered care from wherever, whatever's available. We don't want that. That doesn't work from our perspective. We want there to be this very localised, patch-based, integrated working where people can build relationships. So it feels that it's always felt very scary, this piece of work, because it's actually doing something very different. But certainly our learning is that this is the way to go. And we are optimistic that, you know, with all the other streams of work that are going on around the We Care campaign, our local recruitment drives, which are, you know, ever ending, that actually we will get into a position where hopefully that number will be a smaller number. Let's hope. But actually the quality of the provision that we will be delivering will be enhanced by moving to this approach. And I suppose just finally, I think being able to create more equity across the in-house provision and the external provision, actually being able to pay a predictable payment where providers will be able to then say, this is the money I've got for this patch, how am I going to recompense my workers? And we have an expectation that that's going to be at a higher level than perhaps it is now, and be able to create runs that are much more sustainable instead of having people running from, I don't know, Grosmont to Caldicott, for example. You know, that's not unheard of in some instances. Being able to mitigate that and bring it to a locality where you can build those relationships across the whole system has got to be a better way forward.
Sheila, you just come back and then Ruth.
So I'm not on. I was going to ask if you've seen this working somewhere else, but it sounds as though you're leading the way on this one.
Yes, and it is short. You know, there are a variety of examples of where, you know, different models have been tried, but we haven't seen anywhere that's doing it in this way. And I think also we see models in other areas, and you always have to have a weather eye on that. You can pick up some of the positives that they do, but every borough, every county is its own unique footprint. So, you know, even in our own county of Monmouthshire, Abergavenny is very different to Monmouth, is very different to Caldicot. And so by working in this patch-based way, you're then developing the services to meet the needs of that area. I think also when Julie said whole systems, you know, this also is including, you know, our district nurses, our chronic condition nurses. So it is hoped to be a very, very bespoke way of working.
Sorry, Paul, I didn't notice you.
No, thanks, Chair. We've obviously got two of our providers here this morning. I'm just interested to know a bit more about the cost modelling and whether all our providers are on board with that modelling. And from from the provider's perspective, do you think the way the modelling has been done thus far is fair? You know, is equitable to yourselves as well in terms of payment? So I've just been interested.
Right, in regards to payments, at this moment in stage, I haven't been privy to the actual costs and money that we're actually going to get paid. I am fully aware that everybody involved knows different areas are going to be cost, you know, different. So obviously I'm quite interested to see what these are going to be. Any model moving forward has to be an improvement of what we got at the moment. So at this moment in stage, I can't really answer your question, but I am very, very open to what's actually going to be coming.
Cost modelling. I'm conscious that we have a finance person behind as well, so I'll just be careful how I answer this. The modelling has been done over quite a long period of time, and obviously there's been some changes in personnel. So not every, you know, the people that have been on the journey, as we like to say, there are currently 14 providers. Of those 14, I think I want to say 6 or it might be 7 that have been intensively involved in that creation of the model. The last piece of work that's being carried out is the lead commissioner, Kerry York, has been visiting each of the providers in Monmouthshire, those that are in the bubble, as we call it, and those that are around the edges of that bubble, to actually cite everybody on exactly where we are, what the model is going to look like, and getting to the place where that costed model is going to be, if you like, implemented incrementally as we move forward from April. So that information is now, you know, being brokered, if you like. And in terms of the model has an inflation built into it, particularly to take into account training and other issues around rurality. I can't remember all the list of things that have been added in, which has meant that actually that area of our budget will see an increase, and it needs to, and actually probably needs to see an increase more as we move forward. Certainly we are, like I said earlier, we are of the opinion that we need more parity because we deliver care together. So actually, the nearer we can get, I mean, I don't think we'll ever get to the place where it's 100% parity because of the structures of our organisations. But actually, if we can get nearer to that, that starts to address some of the inequalities and also acts as an incentive for people to potentially be able to come towards this way of working. And I'd quite like Eve to just talk about some of the initiatives that she has been bringing to this around the recruitment, if we can, because I think it links. Would you mind just saying about you, 2 grand and you?
Yeah, we have we've put in, I mean, there's an awful lot we've been doing around recruitment. There's obviously the national recruitment, but also we've been doing some local recruitment initiatives. And some of the things we've done, so for example, we applied for some intermediate care funding money, which was successful. So we are going to be able to offer, you guys don't know about this yet, but it will apply to you as well, offer initiatives for people to come and work in Monmouthshire. So a start-up amount of money of £2,000 to enable them to, you know, pay their bond, towards their rent for carpets and curtains and, you know, things like that. Because we acknowledge that, you know, particularly for some of the younger people that come into work and live in Monmouthshire, is not always that easy to find affordable housing. We know that lots of people do a health and social care qualification in Coleg Gwent and then don't go into that area of work. So it's where do those people go and how do we attract those people when we have, you know, some quite aggressive employers from other sectors who, you know, can, you know, do different, like Amazon is you know, posing quite a lot of challenges at the moment. So we've got this initiative, so we're going to be advertising that soon. That will apply to anybody who comes to work in the care sector in Monmouthshire, and we're just working through the sort of contracts and logistics and then sharing that with our independent sector so they know. We're also making sure that we can offer people robust training opportunities to do their MVQ, their registration fees, so that when the new registration comes in next year. And we're also working very closely with some of our housing association providers who are doing work programs to get their tenants into work and how we can get them from you know, MHA, Pobble, etc., people that they're working with, and using them as links to get employment in the care sector. And we're also looking at the care apprenticeships, and an application has gone in around a bid for care apprenticeships. And we were at the fireworks in Caldicot doing leaflet drops. Sorry, I just thought of something else. And some of our staff have been on a training around what's called value-based recruitment. So it's about using different techniques to recruit people based on their values and their principles, and whether they will be well matched to work in the care sector, and what we can then offer those people to help support and grow them.
I've got Ruth next, and then if I may, I think it'd be good to hear a little more from the providers. And then I've got, after
thank you.
Ruth, then I've got
There's two
Louise
things
and,
I'd pick up on. One, I'll go straight to Eve saying, obviously we want more carers. But the thing is, I dare say in a rural county, they very often need to drive, and then they've got to run a car and so on, which is expensive. But no, I'm very enlightened by what Julie was saying about the patch. And with rurality, and my ward is very rural, people tend to look forward to that carer coming, and they like the continuity of the same person coming. And I think because they're quite private very often, the older generation, about whatever their problems are, whether it's physical, mental, whatever, they tend to progress and improve, I should think, if they're happier with the person that they sometimes just need a chat with, to be honest, that their initial needs aren't always bandaging and whatever. And I think to keep it like that, and the continuity and the familiar face helps them improve, I should think, a lot better than if it's somebody different that comes rushing through the door and out again. So I think it's a great step forward, actually. Thank you.
Sorry, I was just wondering if you wanted to add anything to what you've already said. I mean, I noted you said when you were talking about the pricing policy, although you hadn't been shared with you, you said at the present time, I think your words were something like, it's got to be better than what it is now, or anything's got to be better. So I just wondered whether there was anything further you wanted to say about what it's like to be, you know, a provider of an independent provider of care, you know, working in Monmouthshire with the authority, and what are the things that are difficult, and what are the things that, you know, you're working on, and what are the things you feel that perhaps the authority could assist with, or could be working closer on. I'm not sure. And I know that, you know, there are good relationships with many providers, and there's very close working relationships, but that would be really helpful. Is that okay? I mean, clearly, and just to say, you know, I know that it's you know, it's a very odd environment to be communicating with people, but you know, please just, you know, kind of as long as we can hear you, that's all that matters. Thank you.
We'll have a go. It's working, is it? Yeah, basically, I think the same issue that I have for my company is probably going to be the same for every care company in South Wales, right throughout the country. It's going to be recruitment. We in Wales, obviously, now going through the registration process for carers, stepped process for different sectors within the sector, for one example, but domiciliary. Every carer has to be registered by 2020. April 2020. That comes with its own challenges on top of the existing issues with recruitment. Absolutely fantastic for the sector is that we're actually getting qualified carers that go through the registration process. The issue with that, excuse me, is that we're still paying carers the living wage, or not much above the living wage. We're expecting people to become professionals for very little money. I have carers now that's coming towards the end of their working life that now have to go through a particular qualification, not necessarily the NVQ or the QCF, but you know, still some work that they're not used to doing. Extra fees on top of the actual registration, which Abbey Care have said that we will actually pay back to our carers. That is an expense that they came back, so we are paying for their registration. But then you also have on top of that then the upkeep of that registration. Yeah, it's still all fairly new. Like you said, you know, the deadline for us is 2020. Qualifications change all the time. There's questions around, do we expect carers to be doing different qualifications moving forward all the time? When you put that to them then in interview, they can say, I can go to my local supermarket chain and earn over £1 more an hour to put baked beans on the shelf. Not to belittle their role, obviously. But what we expect for what we are paid, I think is quite bad. It's not against Monmouthshire Council at all. It's nationwide. I don't think people necessarily understand the importance of what a carer does. Usually see it in the social media. It's all you just go and make a cup of tea. So yes, that may be what we do, but we don't just do it for one person. We could potentially be doing it up to 15 people a day. The money aspect then means then we're looking at carers then that have to do 12-hour days to earn even longer potentially, yeah. I myself was out on the weekend. I did a 16-hour shift to make sure the carers actually had a break themselves. I went out and helped out. Now, I don't think that would be ever solved overnight. I think the way we are moving forward in regards to having these qualifications is absolutely fantastic, because it gives us a base where every carer has the same qualification. Okay, but it needs to reflect in what they actually earn for that position they actually are working towards. Like I said, our company are paying the registration fees at the moment. We are helping and facilitating people with QCF training, which is free. But I think just at this moment in time, there's still no real long-term plan in regards to getting additional pay. I was quite moved by the fact that there's potential, you know, with the turning the world upside down with these patch payments, that there could be a potential for the pay increase. So I'm looking forward to working with the council on that, really.
Helen, do you have anything you want to add to that?
Well, our company's the same as Andrew's. We're faced with these challenges every day. In Ask, we have started a new project that we're doing where our carers are actually block paid. So the council, the Monmouthshire have actually purchasing shifts from us. So our staff working in Ask, they're paid from 7 in the morning till 2, and then from 4 until 10:30 p.m. That is working a lot better than what it is in Abergavenny, because our Abergavenny staff are paid per minute, per call. So if they go into a half an hour call in Abergavenny and the family are there and they say to them, you can leave, we don't need you here, the carer's only been there 10 minutes, the carer's only getting paid 10 minutes for that call. Whereas the way we're working in the Ask area, the carers go in, and because they're paid in shift, they get paid for that full shift, and it's a lot more flexible. Whereas in Abergavenny, we're still timed and tasked, and in Chepstow, Caldicot and Monmouth. In Ask, we're not. So we could go into Mrs. Jones and she could say, I only want my tablets now. Can you pop back on my lunch call and stay a little bit longer? So because she's only had 10 minutes on her morning call, we're that flexible. We go back lunchtime and we can stay the extra 20 minutes on top of a half an hour lunchtime call. And that is working a lot better. I've got more carers working in Ask than I actually have in Abergavenny because of the pay is a lot better. Because everybody that comes to us is here, but I'm interested in your Ask project. And that's purely because they are paid. We provide the cars for the carers. We've got 2 company cars down there at the moment. We are looking at increasing that because we've just increased from 4 shifts up to 6 shifts down there, and each shift is run by 2 members of staff. So the service users are getting good continuity and the carers are getting regular pay coming in. So if that could be brought out of the whole of Monmouthshire, I do believe that we would see an increase in recruitment, because my Ask girls are doing exactly the same as my Abergavenny girls, but the Ask carers are earning twice as much as the Abergavenny carers.
Do you mind if I just
respond to that, Julie?
Thank you very much, both of you, for the input, because it's really, really valuable and it underpins, I think, everything that we believe in. And in a sense, Helen's description of what's happening in Usk, albeit we have had to, in a sense, incentivise that because we were having such problems in getting any care provider to deliver into Usk. But actually, it's almost, that's the version of the turn in the world that the world will be when we move into the rest of Monmouthshire. So in effect, Usk is, I can't remember if it's 1 or 2 patch areas that are being run along that shift basis. And what Helen has very ably described is exactly what we're looking to achieve, which is that actually there's better parity, the delivery in terms of, just what you've said about actually having that flexibility to be able to go back. Members who've been on this committee for a long time will know about the Raglan project, which is no longer a project. That's the emphasis. So actually in our in-house provision, in the 30% that we have in-house, that's the way that we operate. And in a sense, the Turn in the World programme has been about rolling that into the rest of the sector, which is 70% of the sector. So I'm just really pleased to hear that it's working well and that you think that actually that could be a contributing factor to actually increasing recruitment, because that's what we're all trying. So it's really good to hear that. Yeah.
Whereas, like for Abergavenny, our staff are from Abergavenny. We have got 1 or 2 that come down from the valleys, but in the Ask area, because of the way they're paid, we've got carers willing to travel from Chepstow, Caldicot down to Ask to provide this service down there.
Sorry, I'm aware I've got some more questions from members, but can I just ask Julie, just on that point? So at the current time, am I right in thinking that at the moment, apart from in Usk, all of our care providers providing packages of care commissioned by the authority are paid on that basis, where staff are going and are only paid for the amount of time that they're in the call? And I just wondered two things, really. First of all, the key issue in recruitment is underlying recruitment. Obviously, we appreciate the issues you were talking about in terms of qualification, would seem to be recognising the value of the service and paying appropriately. So the first question is that the case? Are those two assumptions right, that that's happening everywhere, and also that the payment is a key issue in recruitment? And then for Julie, just if we're paying on that basis at the moment, but we're working towards moving to the way we're paying in USC, what is the timescale for that? Thank you.
I think it's referenced in the paper. As I've mentioned before, this has been a long programme, and some of the difficulties that we've had, I think it's fair to say, just to share with members, that actually in the past, when we have gone out to the market on a tender or gone to procurement, what has tended to happen is you let hours on a contract basis, and unfortunately that creates that time and task behaviour. That's how it works. Actually finding a procurement method for a place-based, person-centred model has been really, really difficult. In fact, we haven't managed to do it. Hence, why we've taken, USC is a good example. USC was a crisis, basically, that we had to do something, and we didn't know whether it was going to work either, but thankfully it has. But the rest of the rollout starts from April. Now, this doesn't happen overnight. These things take quite a long time to do. Raglan, in our 30% of the market, took about 2 years to roll out completely. I mean, we're hopeful that we can get a head of steam around this and move into this, but we are quite a small authority. We have only got a few people working at this, but we've got great providers who are on this sort of journey with us. So April is the Turning the World date, but it doesn't all end and start in April. So it begins in April, and hopefully we'll move through as quickly as we can. Yeah.
Could you just say if that's right, though? That's right. The way we're tasked is, and the way the pay is the key issue for your staff.
Just in terms of the pay is an issue, but it may not be the whole issue. I think it does contribute, and certainly has in the USC area, but there remains other factors. Not everybody is going to be attracted to work in care, and we need the right type of people to be attracted to work in care. So money is a factor, and I would like to think that by having a better wage, that is going to open up, but it may not solve completely the problem, but I think it is a factor.
We've got Councillor Brown and Councillor Powell.
Yeah, following on from what's been said, is the intention for the USC model to be, going across the piece in relation to this type of thing? Because my concern is that, there was a comment to say that some carers were coming from Chepstow to do USC because it was, a better package than elsewhere. Now, obviously, you can't have a situation where you're taking potential carers from one area of Monmouthshire and concentrating them in another. And the other issues that have been raised, because the level of payment isn't that great, then things like having cars provided and accommodation provided are obviously key issues as well. And I was wondering whether or not domiciliary care were having an input into the LDP with regard to, for example, things like providing key worker homes and things like that they do elsewhere because of the accommodation needs, because the £2,000 per person that's been put in, I mean, presumably that's a grant and only on a temporary basis, and it doesn't solve the issue of basic accommodation to get people into the area if the costs are so high. So you know, it's not clear whether all providers provide cars and what the accommodation situation is and how this could be improved, but also about whether the intention is for the USC idea to be rolled out across the areas. Because my concern is that, you know, if there's, as has already been said, and if there's potential carers elsewhere being taken from their local area because the package is better, although that solves the USC issue, it may be actually to a detriment of other areas. Thank you.
Yes, thank you. The USC, I suppose, in a way, is it did come out of a crisis situation where we had huge problems in the USC area, and we were struggling to get any care except for our own in-house. But USC is, in a way, an example of what Turning the World will be like across the whole of Monmouthshire. So we went out of, you know, the order of Turning the World upside down due to the considerable issues that we had there, and have started basically the model that replicates Turning the World upside down. So in a way, we went early in USC to solve that issue. And I think, you know, when we're talking about payments, I think one of the things that Helen alluded to a little bit before is that it's not just about the money, it's also about the security, the sustainability, but also the well-being and the autonomy that people have in the role that then in itself makes that job more fulfilling. So you can go to Mrs. Jones and she only wants you for a few minutes, but she'd like you to come back at lunchtime. You can do that. You can coordinate your day to suit the people that you're with, and you become part of that community. You develop the relationships and you get that continuity. And I think that as we roll this out, then we will hopefully be, alongside all the recruitment and the registration, we'll be then growing our own within the patches. And I think also because of the guaranteed hours that we're giving in areas, that gives the independent sector the more flexibility to do things like provide lease cars, etc., etc. As for the accommodation, we've been doing a lot of work. In fact, I met yesterday with MHA around opportunities that we might have for renting properties. We've had the same conversations with our own housing department about how we could develop affordable housing to encourage people to come and live and work in the Monmouthshire area. As I said before, we've been doing some work about people who are already residents, but also been looking at some of those hard-to-let places, how they might become more attractive. And I know that Andrew is testing something in the south, aren't you? Do you want to talk about that?
Yeah, no problem. Yes, we currently will be going live, I believe, in the next 2 weeks with a project that we're working together with John Russ in South Monmouthshire, in Chepstow. We would attend regular providers meetings. It became quite apparent there was a bit of a crisis in that area. At one point, I think there was something like 39 individuals that required care in the system, whether it be in hospital, reablement, anyway. So we floated the idea of using a live-in model adapted for home care. Basically, what we're going to do is to rent 2 properties in Chepstow and create runs fairly local to those properties, and we would pay a live-in carer a weekly wage, a set block. This is how much you're going to be paid this week. They will then have all the information they need for their clients, and they will address their needs how they see fit, really. You know, very similar to what is done in USC. You know, not necessarily you have half an hour in the morning, half hour lunch, tea, etc. You know, do what they need in the morning, but spend a little bit more time with them, you know, throughout the day. That will be up until April because of Turning the World Upside Down. But with this scheme that we are taking, I think it's 156 hours in Chepstow alone to see how this actually works. Again, it's using a different model of care to try and fit it to another model of care. So at this moment in time, I've got no feedback on it because it hasn't started, but I will be keeping a close eye on it and seeing how it actually progresses moving forward.
I think what is interesting is we've had to, even though we've got a programme of work that we're working towards, there have been these crises that have happened. And actually, by creating the opportunities that we are, so the house in Chepstow and the work that's going on in Usk, actually we've been very, I think, creative in trying to solve the problems and actually trying these different ways of addressing the issue are really good, because actually it gives us other ways of solving the problem, but always with that intention of trying to keep it local, keep it person-centred, and I think trying to address the issue, particularly around the wage for care workers. So you know, it's interesting that these things have emerged in this last year, in effect, but we're always having to be sort of fleet of foot to find new solutions to solve what is a tricky problem. But yeah, so it'll be really interesting to see how it works out, Andrew.
Thank you. I've got Councillor Powell and Councillor Edwards.
First of all, I apologise for the interruption. It was important with some other issue with an officer. I may have missed something, so if I'm asking something that's already been asked, we like to look after people in their own homes. That is the whole idea. But there's things that people, especially I'm 82 now, especially people my age, are starting to think about, is the fact that you own your own home, but because of that, you probably have to pay for your care. Therefore, then, become the case where you have to sell the house because you haven't, you know, it's like being asset rich and money poor. So you've got a difficult situation there. And is there any answer to that? Because then you come to the stage and then you have to sell the house and then go into a home when you would really like to have stayed where you were and been looked after at home. So is that a difficult question?
I don't think it's a problem that we come across very often. I'm looking at Ty here because we have a maximum charge. So there's a maximum, which I'm going to say £70, £90. So the most anyone can pay per week would be £90. You know, so and that would be, you know, somebody could be having 4 double-handed calls every day, and it would still be £90. And that's what they're assessed for. I think Ty wants to come in and correct me or sort me out.
In terms of the charge, the Social Services Wellbeing Act does lay down the financial regulations on what a local authority has to do when means testing. When someone enters non-residential care, which this is, there's a laid down criteria. Everybody has to be means tested. They will pay the lower of the cost of their service, or their assessed charge up to a maximum £90, like Eve mentions. So, for example, someone could be having 10 one-hour calls a week, but their assessed charge might only be £30. In terms of the property, that's not taken into consideration until such time that someone goes into residential care. And any capital they've got in the bank, for non-residential services, we only consider that when it goes above the level of 24,000 a year. 24,000 in bulk. Anything less than 24,000 we don't consider as well for non-residential care.
Councillor Edwards. Oh, sorry.
That's very varied, and you know, sometimes it can be either. Sometimes, yes, definitely. Welcome.
Thank you, Chair. I expect Roger and I are about the longest serving members of this Adult Select Committee of 15 and a half years, so we've seen a lot of changes in that time. I was very encouraged for when Helen was saying, you know, about the block of working, you know, the shift time, Because if you want to encourage youngsters into some sort of occupation, they want some sort of security and stability. Because I suppose sometimes it can be people, young people who've either married or they've got children, school times, it all has to fit into that package. So, you know, because we want to encourage the younger ones into it, but it can also fit in with perhaps parents that, or mothers that are looking for some part-time work later on in their lives. Because I think we always used to be led to believe that nurses were born and not made. So that's a different criteria. But when also Helen said that the girls are working from Chepstow and Monmouth and so on, how many male people are encouraged to come into the caring? Because, I mean, years ago, you never saw a male nurse in a hospital, but, you know, the last years you do. I think I can remember my mother being in hospital and finding it very difficult to be bed bathed by a young male. But, you know, situations have altered society, and acceptance of all that things have altered no end. So I'm just wondering, are many youngsters in school or something encouraged to go into the caring profession that they would find very rewarding if they had sort of a bit of, not apprenticeships as such, but a little bit of insight on a trial basis to see what's involved? And perhaps, you know, that's a source that we're not looking enough at.
I think it is still very female, but we do have a few male carers, and I think as some of the areas that we work in have expanded, that has actually encouraged some men into the profession. One example is the prison, you know, so that's been something that, you know, male carers have found quite attractive and interesting to be going into that environment. I think the campaigns that we talked about before have had a focus on trying to encourage men to come into the profession. But I think, and as Andrew was talking before, the career pathway opportunities, I think, might also encourage more men to come into the profession, rather than, you know, there's a job as a carer and there's nowhere to go from there. If there are increased opportunities, I think that might make it more attractive. I don't know if you want to anything to that, Helen?
We do employ quite a few men. I mean, across Monmouthshire, I believe we've got 6 male carers. In Abergavenny itself, I've got a full double-handed male run. We've also got females as well. We can do male-female runs where our service users will allow a man and a woman carer to attend. The male will, obviously, do you know what I mean, when it comes to the personal care, the service user is covered up, but it's a whole new way of thinking now with them, because they get used to having male district nurses that in and out of hospitals with male. So when they come home, they will now start accepting a male carer.
Because I'm thinking very often, you know, somebody who's maybe bedridden or something at home that need carers, and there's always the lifting issue. Much as you're trained to lift properly, I mean, if a nurse thinks, yes, I can do it, and the patient pulls them over, you've got a carer then that's out of work then for quite a considerable time. And that can so easily happen. But I dare say each situation, they're assessed with the needs of that individual that might warrant maybe, you know, a lot more male dominance in it because of the lifting.
But with the lifting, we wouldn't lift anybody anyway. Do you know what I mean? We've got to make sure that the right equipment is there for us to do it safely. If somebody does come home from hospital and at our first call we go in and we find that there is no equipment there, it would be all care in bed until we get an urgent OT assessment to be done. And in all fairness, I mean, working alongside the OTs, we can normally get an urgent one done within the hour.
Could I ask if either of you have any further comments you'd like to make to the select committee, or to, you know, for us to take into account as we kind of consider this, because this is a key issue for us in adult social care. We have heard a great deal about the pressures and crises that we've had in the past, and obviously our primary concern is what that looks and feels like for residents that are in those perhaps packages of hours that we don't have any care for, and also those that are perhaps on time and task and so are not currently getting that transactional care. Don't know if you've got any further comments for us.
I would just like to say I've worked previously now for 2 other local authorities in the care sector, and I have to say Monmouthshire is leading the way in how they actually deliver care, and I am quite encouraged by the fact that it's not always local authority led. The opportunities for providers to actually give their opinions and actually contribute to actually solving the problem. I think obviously Helen and I are on different projects in different areas that the local authority are fully behind. I think is very encouraging. It's nice to know that they respect the fact that we are on the blunt end. Yeah, it's the fact that we are dealing with these individuals on a day-to-day basis, and it's exceptionally encouraging to know that our opinions and ways of working is going back to people like this on the committee, really. So, thank you.
Final comments then, Councillor Bavia and Councillor Harris.
There was a few more questions, actually. Sorry, Chair. Just in terms of performance and evaluation work, really. So, obviously, because it's bespoke to those individuals, there's going to be specific what matters outcomes that are going to be measured for those individuals. But just trying to understand how we're going to sort of marry those individual bespoke performance outcomes with more generic outcomes for across the piece. In terms of evaluation, you've said in the report there's going to be periodic evaluation. Obviously, Swansea University has been heavily involved with the meetings that matter work project were really important. Are we looking at any academic independent evaluation periodically, or are we going to do that in-house? There was another thing. That was it. Engagement with the inspectorate, CIW. Just wonder what discussions we've had with CIW around this. How are they going to, I suppose, when they do their evaluation work of our adult services and domiciliary services, how are they going to sort of pick up this as well, and be interested to know those discussions.
Well, I think the CIW, they're fully aware of the plans of how that is going to be rolled out. I think it will be challenging because it is a very different model of delivering care, and I think it'll be very different for them in how they evaluate it and look at it from a performance perspective. I think that what we have to be extremely mindful of is that it'll be challenging for us when we're inspected, but also to be challenging for our independent sector. So we almost have to work together on making sure, because time and task is easy to measure. So in some ways, you can tick the boxes from that. We haven't specifically nailed down how the quality, what the quality assurance framework will look like. I think one of the challenges that you have when you're working on a patch-based way, as we're proposing or as we're intending, is that there are so many elements that can make a difference or have an influence. It's very difficult to say that is because of that. And I suppose what we're trying to do is flip that on its head and say, does it matter? So we have been doing some work around some of the how we look at evaluating things. I'm thinking of the Toby Lowe things, Julie, where we're looking at different ways of how we gather this information, because it won't even just be the county council bits of the business and the independent sector. It'll also be the third sector and health, and you know, what we will hope to do is look at overarching outcomes for people, but also I like to think a bit more of the consequences. So do we then start to see less people going into hospital, less people going to their GPs, less people making demands on other bits of the business, so they fall out of that way of working? There was a lot of questions all in one there, Councillor Pavia. Is there anything else?
Yeah.
It's interesting. We haven't necessarily sought a partner to look at this in any evaluative way. But we have a very good working relationship with the Swansea University Social Care for Wales Research, and actually some of our early work around our outcomes and our what matters was all part and parcel of it. It feels like that was quite a long time ago. It's interesting, I was telling Eve earlier, I was talking to some colleagues in Torbay who are trying to look at other ways of delivering this sort of approach. And it'll be really interesting to learn from others as well as they begin to do different things. So I know Carmarthenshire have done some slightly different method of procuring. I think everybody's trying to find their own way with this. I think I wouldn't be against it. In fact, I'd be for it. But I think we'd have to decide at what point would it be useful to bring in some academic research, if you like. I favour the let's speak to the people and find out whether this is actually delivering against their outcomes that we are brokering with them. And I think anything that we can do to aggregate that to a level that we can, in a sense, scrutinise would be really useful. And certainly the work around Raglan, you know, tenfold tells us that actually that is the way to... And I think we can measure it in other ways as well. I think Eve's right. There are so many measures that you could look at to say, how could you attribute across this whole system? Things like complaints. I was only having this discussion yesterday. When I first started in the role that Eve's in now, one of the things that concerned me was how much noise we had in the system about things that we've talked about today. Not the same carer, people not turning up. I don't hear these things, and I haven't heard these things for quite some time, and I think we've got to use some of that. It isn't anecdote, it's real, but you know, you could say it's anecdotal. Those things are not a feature of our system because we're addressing that personally. So how we capture that in some way that perhaps can be shared with others and that we can reassure ourselves that it is the right direction, I think we will invest in. I think at the moment we're just in the let's see if we can get it over the line and get it moving. And I think it's a good point.
And I think also there's a lot of progress being made in how we gather qualitative information and then transpose that into something more quantitative. I'm involved in a project with Welsh Government at the moment that's being funded by Welsh Government called Measuring the Mountain. And that's about gathering stories, you might have heard of it, from people or carers. But the way that they gather the story, they can then put through a digital tool and come out with an analysis. So it feels like a more appropriate way and a better way of actually ticking both boxes. So it might be that we can start to adopt something that enables us to get some of that harder data that people want to see. Have you made a difference? But collecting it in another way.
Okay, was there a final comment from you, Roger? No?
Thank you, Chair. Yeah, just to say it's good to hear about the appreciation and cooperation between the county and the independent providers. And you just mentioned, it seems obvious to me that that should be the way to go. And I'm surprised, it doesn't happen elsewhere. or doesn't happen as well elsewhere. And I think it's important, it's out in the public domain now, but I think it's important for that information to get fed back to the appropriate cabinet member one way or another. And your staff obviously know that, but if they don't know that, make sure that they do. The more sensible cooperation is the most logical way to go. It helps everyone, doesn't it?
Councillor Pavia, have you got...
Sorry, Chair, but thank you for your indulgence. Just in terms of the gaps, you know, we've obviously highlighted the issue of gaps. And I think I referenced the last council meeting, the report done by Social Business Wales, and that mapping work it's done around the foundational economy and, you know, the need to grow health and social care sector. So I suppose we've got a choice. We either increase our element of the sector, the domiciliary care sector, if, you know, that independent sector is not going to come in, or we look for another way, another model. You know, we've seen obviously other models around Wales, Solva Care, how we bring in, you know, charities, cooperatives to deliver something else, either with us or in a wider collaborative. I know you said at that point, Julie, how difficult it is to get those social value organisations off the ground in many respects. So it's just to understand the appetite out there, really, county-wide. What is the appetite? If not within county, is there something regionally that may be, you know, that may help us longer term, not just help us as an authority, but, you know, region-wide?
It's interesting. When we were doing the Raglan work, the staff were so enthused by what they were doing and loved it so much, and, you know, continue to, that we thought that there might be, and we had conversations at the time very tentatively about what would the opportunity be for some cooperatives. And I suppose the question is, why would you set yourself up as a cooperative if you're working in an environment that's allowing you to work well? So there's something about where's the fertile ground, and I'm aware of Solva Care, but it's a small bit of the business. And there are other examples across Wales which are fantastic. You know, we'd all love to see much more of a mixed economy, I suppose. I mean, we've got big guys and small guys, as I call them, in terms of our providers. We've got homegrown Monmouthshire ones, we've got nationals and regional footprint providers. You know, there's a piece of work going on at the moment from a government perspective looking at the rebalancing of care, as in an inquiry into looking at what should the balance be. I think it's fair to say that we like our balance. We think it's a good balance. And I think it's because we've invested in those relationships with our providers. When we started the work on Turning the World, we went out UK-wide and said, who wants to come and play differently, in a sense? And lots of people expressed an interest. But of course, you need to be in a Monmouthshire setting to deliver in a Monmouthshire setting, or be near to it in order to understand how that's delivered. We've had many meetings. We got very excited, I think, and Eve, we got very excited about Social Firms Wales and the Wales Cooperative, thinking there will be opportunities. Because we see ourselves as real fertile ground for this stuff. And we explored on a number of occasions. I think one organisation basically said you need to do it on a bigger scale, and there is something about the economy of scale that we didn't have in terms of the business offer. That was down one particular route. The cooperative route, you know, we have an emergent, very emergent direct payment cooperative, so a group of people who are working together very slowly to try and, in a sense, organise their care together. We're supporting that because we see that as really positive. So I think if there was an appetite, I think we'd be on it. It's just that we're not getting that particularly at the moment. But we'd definitely be. We think we're fertile ground.
Okay, well, thank you very much. I think we've had a very wide-ranging and positive discussion and debate around this issue of topic of domiciliary care, which we all think is vitally important in the county. I suppose to sum up and to conclude, I think it's really important that we note that Monmouthshire is considered to be potentially leading the way in this area of work, and I think that's very pleasing for members to hear in terms of delivering in a different way. We're also extremely pleased to hear about the positive relationships with providers, because I think we'd all be in a very difficult position and unable to deliver if those relationships weren't really strong. I think we've heard that in terms of recruiting carers, there are complex factors at play, but factors which include the matter of qualification now, which we see as a positive, but could potentially be an issue for some people. But also the issue of value, both in rates of pay and also how highly valuable we see care as being, because it is a very different endeavour than, you know, not to, as you say, minimise that, to working in a supermarket potentially. And there's something about how we can value that, I think, going forward. I just wanted to note a couple of things, and I don't know if committee are content to consider these as, you know, things we would like to follow up on. We are pleased that the USC pilot project is working, appears to be working well, and that it will be rolled out as of April. But I think hearing what both Julie and Eve have said, I think one concern would remain that we would like to see that is rolled out with some degree of, I can't remember the term you used, Julie, with a head of steam, I think it was, because clearly there are issues for the providers delivering in the longer term without those kind of guarantees. I think I think it would be really helpful if at some point members were cited on the payment regime for, you know, how that's set out, the schedule. Would you agree, members? That's something we would welcome. And obviously we would welcome that the providers are cited on that as early as possible. I think that I saw members kind of, you know, there is some concern about the time and task model and the impact that probably has on both the people providing the care and on those who are being cared for, that we would wish to see moved into the new world order as soon as possible. Would you agree, members? Yeah. Okay. I note Councillor Brown's comment about whether we are considering key worker homes in the LDP, and wonder whether that is indeed something that we can both ask Economy and Development to consider in their deliberations, because they're leading on the LDP process. And also when we write, that we ask the Cabinet Member and the Cabinet Member for Planning to consider that as part of the deliberations, because I don't know, members, if that is currently being considered as part of the affordable home strategy. Are there any other conclusions that you feel that we need to draw? Oh, sorry, one other one. The issue of evaluation. I think there was a suggestion. I think the suggestion is we would recommend that there is a very robust evaluative process for turning the world upside down, because we need to understand that, and perhaps there is a part for members to play in that, and whatever that looks like, I think we would welcome understanding what we are measuring against and how we are collecting those stories. Is there anything else that I've missed?
Yeah, I think it would be helpful, because obviously this is going to start in April 2020, if we come back with a follow-up report on how it's doing and what stage we're up to, so that we know what progress is being made, and hopefully for the independent providers to come along as well, so that they can give their viewpoint on how it's rolling out. Thank you.
So would that be around October, November next year? So 6 months in, to see what the level of progress is and has been made, members. Yeah, is that fair? Okay, well, can I thank you enormously for coming in? We really, really welcome the fact that you've been able to make the time. I'm sure from what you say that, you know, you are working in a very busy environment, and that members are very grateful for you for making the time. So thank you very much. Thank you. And I'm sure that you have lots of other things to get on and do, so please feel free to leave while we just change over and go on to the next report. Thank you very much. Yeah. Do you want to just have a quick 2-minute break, members, while we swap officers? And thank you so much. Thanks.
Good morning. We're starting the session again for adults after a short break. Our next item is a safeguarding evaluation report, and I think it's over to you, Julie, to give the report. Thank you.
Thank you. So today we're bringing the safeguarding evaluation report. The purpose of the report, which is highlighted, is to really give members an update on progress around the key safeguarding whole authority safeguarding priorities, to inform about the effectiveness of the safeguarding arrangements that we have, to obviously be protecting adults and children who are at risk from harm and abuse, and also to inform members about the progress made towards the standards in the Council's corporate safeguarding policy, which is also appended. Just in terms of some of the key issues, as members will see, the safeguarding evaluation, which is at Appendix 2, is based on the activity and information from April last year to March this year. And what we've tried to do is take a bit of an as-is position, so recognising that that's the time frame, but actually recognising that there is a time lag. So actually, in effect, we're giving an as-is position. The report very much speaks to the corporate safeguarding policy and the duties that we have placed within that. And just drawing members' attention to Table 1, which is the sort of cornerstones that we're using against which we measure how effective or not we are in any given period. So we're particularly looking at good governance, safe services, a safe workforce, robust protection and preventative approach, and those are the main areas that we are measuring the activity against. I think I've been in this post for about a year now, so I chair the Whole Authority Safeguarding Group. We are trying really hard to embed all of the principles from a sort of adults and children's perspective around safeguarding, but actually ensuring that that's embedded into all council areas. And this year we've taken a slightly different approach when it comes to the what are called the SAFE audits, which are referenced in the report, which sees every area of the council that is, if you like, front-facing and has contact with people, to evaluate the activity against each of these areas and look at to what extent each directorate is effective, efficient, and is compliant, if you like, with the standards set out in the safeguarding policy. What we've done this year is take a slightly different approach, and we're running a series of workshops. We've held one. There was one got postponed last week, but we are going to be running a series of, I could say 4.5. It's nearly 5, but actually we're going to amalgamate one of them. So 4 workshops where we have all the chief officers present, and then a selection of staff from each of those directorates talking to their safe audits. So it's a bit of a dynamic process, asking people to share what have they found in their area of the business, how and where are the gaps, and how are they looking to address those. And we're hoping that this is going to really help to embed more of that culture around safeguarding as we move forward. So I mentioned the sorry, I went off at a tangent then, but I just wanted to mention that. In terms of the Whole Authority Safeguarding Group, as I mentioned, one of the other areas that we have looked at as a group is how are we assessing our progress, and you'll see in Table 2 against the 5 cornerstones that we have, some scores that we have had basically some quite robust conversations about. So for example, let's take good governance. In April 2017 and up until March 2018, you'll see the score move from 4 to 5, and our current rating is a 5. And that's largely been brokered, if you like, from conversations about, so where is our evidence that says that we have good governance? So our Whole Authority Safeguarding Group is meeting. What are the arrangements in each directorate for making sure that that governance actually, continues to embed through. Similarly with the safe workforce, that's one of the areas. Safe workforce is one of the areas where we've actually marked ourselves down. So it started at a 3 a couple of years ago. It went up to a 4, and we've actually put it back down to a 3. And that's in recognition of the fact that actually some of the way in which we, as an organisation, are able to run reports from our computer systems is not robust enough. So we wanted to mark that down and actually make reference to the fact that we need to invest more in ensuring that we've got that, if you like, push button approach to being able to get that data out. Just in terms of, I was just going to pick up on some of there's a bit of a chronology in the report that talks about the journey that safeguarding has been on in the authority, going right back to February 2014 with the ESTIN work. We've also had the authority then came out of its special measures programme in November 2015, in a sense trying to put together for members a bit of a chronology of where we've been and where we're hoping to get to. We're currently coming off the back of Welsh Audit Office inspection work, and members will remember we brought a management response here probably about this time last year actually. We have now been re-inspected on that management response, and we are expecting, and it was a lighter touch inspection, which included interviews with some chief officers, some of the safeguarding leads and people from the other parts of the authority, just to touch base with that management response. We are awaiting the report or letter, we're not sure which it's going to be, and we're hoping that that may see the end of this round of external inspection activity. So, you have a good feeling about that? You can never tell, Roger. You can, you know, in a sense, they're very nice. We've had a change in personnel in terms of our WAO inspectors, and they were very, very nice. But you never know what's going to get written down. But hopefully, you know, we've been very honest about where we are. We shared all the information. They came back for a little bit of information last week, which we've again shared. I think really doing that proper scrutiny of making sure that actually it does line up and it is tied off. So fingers crossed. We'll obviously we'll be bringing that back in as well. Just in terms of Appendix 2, again, I think we've just changed the way that we want to present this information. It'd be interesting to hear feedback from yourselves. We've tried to simplify under each of the headings, the cornerstones. So what does good look like? The progress and evidence that we're using that actually is part of our evaluation, some analysis, and then next steps in terms of what we're taking forward in each of those areas of the report. I'm not going to go through them in great detail, if that's okay, and obviously we can pick up through questioning, but I would be particularly interested to see whether members have found that a useful way of us trying to evidence against the 5 cornerstones, whether or not, you know, the sorts of activity to give members that insight into what is going on. And I personally, I gave some feedback to Jen that I thought it was a better way of presenting the information, but I'd welcome your feedback. And then finally in Appendix 3 are some of the key actions that we'll be taking forward and obviously reporting on again next time we come in. And again, I'm not, unless you want me to go through them, I wasn't planning to go through them, though we can pick them up through questioning if that's okay. But there's fair to say there's quite a lot of activity going on. I hope that's okay.
Yes, thank you. Yeah, if there are questions from members of the committee. Roger, you first, I think.
Thank you. Sorry. Get it right. Thank you, Chair. Lots of little bits in here, so I won't attempt to cover them all. For example, when you have percentages, could you let us know the numbers, because that makes an awful lot of difference. You know, if one percentage is on 3 bits of information, the other one is on 20,000, it does make a hell of a lot of difference. Well, in particular, where are we? In particular, on the robust protection, 76.79% down from 84.73, etc. It would be good for us
Sorry
to know.
to interrupt. Can you point out the page in the committee so people
it's
can find it?
page 13 of the report I printed out. Yeah. What else was? And can we have they're mainly mentioned in here, but can we have a glossary of acronyms? Most of them are down there, but there's one on my page 7. SBAR, previous use of the SBIR. What the heck is that? Don't worry. So there we are. That proves it.
Can I just mention that though, because actually it's one of the key changes. It's a change in terms of the way that we're going to operate. So SBAR, I can't even remember what it stood for, but it was a health document that I think when Claire was here, they were using it as part of a way of highlighting concerns. We're taking a slightly different approach and we won't be using it, so it'll disappear from the language. But I do take your point about a glossary of terms, because there are a lot of terms in the land of safeguarding. Yeah. I think it would be
most
quite
of them
useful.
are covered, but some aren't.
No, I think that's a good point.
Yeah. So I'll shut up now and somebody else can have a go.
Yes, Paul, thank you.
Thank you, Chair. Just just looking at the two areas where we've sort of been really critical, and in terms of safe workforce, in terms of what good looks like, we ensure that workforce working with children and adults at risk are suitable for the role that they're employed to do, and also focused on outcomes of people. I suppose for me, and to also understand the allegations, managing professional allegations, particularly when you've got an older element of the workforce, particularly in, I'm just thinking of education, and come at it from a school government perspective. Those teachers potentially are on the end of their career pathway. How difficult is it to potentially manage some of those in terms of changes and understanding? I know, there's a huge amount of training, and expectations are drilled into them, not just from a county perspective, but management perspective from head teacher, deputy head teacher. But there's also an element of those individuals have undertaken a lot of their professional career in a very different environment, and it'd be interesting to understand those allegations have been brought forward. Have they been largely in the teaching profession, or is it it's one of those areas that as a governor, it's been a challenge, where there have been issues, and it's not for malice or cruelty. It's just a different way they've operated in the past, and that they go at incidents in a different way, even despite all the training and everything else. But it'd be interesting just to hear your views on that, really.
I think it's a very interesting point, and you could actually, and we do. I've chaired a number of different hearings where I've come up against not necessarily teachers, but older people in our profession, in social services profession. I think the key is in training, and it is in the expectation, and it is in ensuring that people understand that perhaps what might have been acceptable in a career that spanned 30 or 40 years definitely isn't now, and that trends and fashion, if you like, have changed, and our tolerance for acceptance around certain behaviours just isn't there. I would urge, though, that also there has to be a balance, and that sometimes we have regular conversations about this, where a allegation will come in. There has to be, and certainly those people who are dealing with this are very skilled at understanding both the context from where that might have come from, the understanding about the individual, but also balancing that against where's our tolerance line. And our tolerance is we don't have any, really, in terms of if it falls into the realms of abuse or harm, then it has to be investigated. So, but I think that different people have different tolerance levels, and part of the job often in safeguarding is managing that interface. And like you're saying, being in the school governorate, people will be, a range of lay people will have very different experiences in life and have very different tolerance buttons. And I think that's really tricky sometimes. And I think when that then comes into the formal professional allegation sphere, it can sometimes feel a bit harsh, whereas actually we're trying to uphold a standard. So I think, you know, I'm confident that we get that right. I would say, you know, 99.9% of the time, and that there's robust challenge. But I think education is definitely part of that, and that nuanced debate, which I'm sure goes on in governors' meetings. Yeah.
Anybody else want to ask a question? Sheila?
Thank you, Chairman. I'm just looking at page 23 with regard to the robust protection, progress and evidence, which is at the beginning of page 23. The reference to adult protection inquiries that were completed in 7 days, that appears to have dropped. I see it in the action plan. I mean, the report is very good. It's quite easy to read through, but the key actions, I just think it would be helpful to have some sort of a cross-reference to specific things like that, where I found you've got to consider capacity issues specifically for adult protection, so I can see it's in there, but I just wondered if you could have a look at some way of cross-referencing these things so that we know where to find, we know what it's referring to, basically. I just had to scroll through it all to find it. But there are other things, but that's just one example that I thought would be helpful to have some sort of cross-reference. But otherwise, it's very easy to read through. Thank you.
Thank you, Councillor Woodhouse. I think that's a really good point. The other point that I would just make around that, in terms of it being in the action plan, we have seen a significant rise in the adult. I think I talked about it in council when I did my annual report. It's been one of those exponential rises, and a lot of that, again, when we're just talking about thresholds, is to do with the fact that the threshold has gone down. So actually that duty to report in an adult world, in a sense, our gates are much wider than they used to be. So actually we're experiencing very high volume because of a legislative change. But obviously we've got to look at ways in which we address that in terms of managing that moving forward. But yeah, I will make that point.
Yes, thank you. I think the danger is at the moment is that, as has been pointed out by Hazel from the scrutiny point of view, that we're looking at the sort of the contents of the report as opposed to some of the factors that are being put forward. Because if you look on page 19, there's a number of issues there that are raised in that top box, which talks about 48.21% of the workforce are still requiring training. And then it says there's been a previous query in the pre-meeting about basic awareness safeguarding training has been undertaken by 38 council members level 1 and 35 at level 4 and 7. And I wondered if you could explain that. And then the other question on that is the managing professional allegations. It talks about, you know, the figures there under professional strategy meetings. And, you know, obviously the question there is about cases and how they're concluded and, you know, whether there are further safeguarding requirements. And I think the other thing is that although we've got a table later on saying that the different directorates have got to get things in order by certain dates, I mean, I think this analysis is good in the sense that it gives us some practical information, but we don't know, for example, in education, how well home to school transport is doing, for example, in relation to safeguarding of bus drivers and taxi drivers and so forth in terms of transporting children to school. So if you could just do a bit more on the sort of the progress side, because I think, first of all, it seems as if 48% still outstanding in level 1 training is something that we would have hoped would have been higher at this stage, and we're a bit confused about the level 4 and level 7 of training of council members, and then this business about managing professional allegations. Thank you.
I think the whole issue around training it's an ongoing, not an issue, but it's something that we have to, get better at ensuring that we've got everybody trained at a particular level. I think I think we need to look at the as-is figure now, because obviously this is relating to a period that has passed, and it'll be interesting to understand what that figure is now, not the 48.2. But I think what has improved over the last bit of time is actually our ability to be able to give a figure that identifies how many people are left to be trained, because actually not that long ago we weren't even able to say that. So even though it may not be a good figure, the fact that we know what the figure is feels like progress to some extent. Clearly it's not 100%. The basic awareness training referred to in terms of council members, so 38 members at level 1 and 35 at level I was reading this just now and thinking, I'm not sure how clear that is. I need to go back and just double check with Jane what are we meaning there, and also perhaps some further definition about what, because I don't believe that members have training at level 4. I think you have level 1, and 2 at a push, depending on where you are as an elected member. So I'll go back. So I think that's not exactly. I think there could be a bit of a typo issue. This report came late as well, so I want to just double check that. So we'll take those back. What was the third question?
I think the question was to do with the next part of this.
It was the professional
managing professional allegations, because the question I've got here from the Chair is, can we be assured that these were timely and that the children involved were safeguarded and not suffer harm? And so if you could answer that question, because
so
obviously
in terms of the managing professional allegations and all the professional strategy meetings that fall out of that, I mean, in effect, what we're giving you is the top line cut of information. So you've got, in a sense, there were 33 adult professionals discussed in relation to 33 children. So in terms of how that works, so these allegations are investigated and then go through the formal children or adult safeguarding approach. And obviously that's a formula that's laid down, that's nationally agreed. And actually what would come out of that would either be further action, whether if that was a member of staff that required further disciplinary action or potentially other sanctions, or any of the issues that have been raised in relation to safeguard. Our first port of call is to do the safeguarding around the individuals, be that the child or the adult, and there will be a plan in place that is then reviewed and monitored through the formal structures of the safeguarding process. So even though you haven't got that actual information in there, there is a process that sits behind that takes all of that. All we're giving you here is the, if you like, the top level information. So within that period, 24 of those investigations at a strategy meeting and or further investigations were concluded. And of that, 10 were substantiated, so there will have been further issues that would have been carried forward, and 11 were unsubstantiated. That doesn't mean to say that there isn't safeguards put around anything that isn't found to be. So I hope that answers the question.
Yes, thank you. Have members got any more questions, particularly looking more at the, scrutinising the report? Roger, thank you.
Yeah, mine's quite a simple one. What is Operation Quartz? Where are we? Operation Quartz. It's on page 10 of the report. working through multi-agency approaches to tackle safeguarding issues. During this period, 17 children were subject to CSE strategy meetings and 7 made subject to Operation Quartz.
So I'm just catching up with the with where I'm on the digital and you're on the paper.
Yeah.
So I'm just trying to work out where that is. I'm going to go back.
It's on preventive approach.
Yeah, I'm going to go back and ask the question. There are like you mentioned earlier, there are so many acronyms that Quartz, I believe, is one of the CSE. What's the word? Subsets of other, other people that.
Yeah.
So I think we definitely need the glossary of terms because that's not one I'm aware of.
Yeah.
But I can find out and come back to you on that, Roger.
Right. Thanks, Chair.
Paul.
Thank you, Chair. Just, I know in CIW's performance review letter, they said they were concerned about challenges in relation to timely completion of child protection conferences. Is that being dealt with now?
In terms of our performance around that area, that's been an improving picture. Sometimes, in terms of CIW, they're not following up on any further issues around that, but it is one of the measures that we have to keep on top of and actually be aware of. So at the moment, I'm not given any information that's telling me that I'm worried about that, but that isn't something that's being followed up at the moment. It's one of the PIs that we have to follow.
And is there still going to be a joint inspection of children protection? It says in late 2019 there's going to be a joint inspection with Estin and HMI. We pilot a joint inspection of child protection arrangements. Is that in relation to us?
That's not that we're aware of,
No.
but there are pilots going on, and obviously sites will be. I'm just trying to think. Somebody's just told me who's going to be one, and I can't remember off the top of my head who it is. But we haven't had information yet. That's not to say that might not come.
Right, I think unless there's any other things, I think if I can summarise up, I think we welcome the report. In terms of the understanding of the report, it would be helpful if percentages also included numbers, the point that Roger made, and acronyms and things like Operation Quartz. It's not just actually a glossary. I think it's also making sure that it's explained within the context of the report so that you don't necessarily have to look at the glossary. We looked at the question was raised also about people who were older and not used to necessarily the same standards of safeguarding. And I think you answered that by saying that effectively, I mean, correct me if I'm wrong, that we've got sort of higher standards in terms of, of sort of zero tolerance in terms of abuse and so forth. I think it was of... there was also a point made by Sheila about cross-referencing as well, and we were concerned that nearly just under half still hadn't undergone the training, although you said it was better now than it was before because we didn't even have those figures, but on the other hand, it would be useful to know when we're likely to, in terms of scrutiny, when we're going to get to this sort of 100% type of point of progress on it. And I think, Paul, you wanted to add something, did you?
Sorry, Chair. Yeah, I just in relation to looked after children numbers. We're obviously around the 170 mark. I think Paul said it was. Oh, it's gone. We were sort of 172, 199, right? And that's the thing, we've said about our level of tolerance, and obviously not all of this is within our gift. We have to look at the judiciary as well. But is our level of tolerance such that we're bringing children in? No, it is predominantly judiciary that is no, it's not leading a mix. Okay.
It's a complex picture. Obviously, the trend is rising, not just in Monmouthshire, but it's everywhere. I would want to make sure that we're very clear about that. There's a whole host of factors that are contributing towards this. I think the discussion we were having earlier about the thresholds around allegations, particularly professional allegations and members of staff, yes, you can read across potentially, but actually the threshold at which somebody, a young person, a child, is brought into our care, if you like, that's a very considered assessment as to whether or not. And I think what we've been doing, and this happens across the Gwent region and wider, is that work that looks at that threshold and says, is it, too loose, too high, too low? We've interestingly been having some new members of staff who've come into management positions in Monmouthshire, and it's one of the questions we ask. And of course they're saying it's right. It's the right threat. So that's good. Some reassurance for us. And interestingly, just on Friday, we were with some heads of service and directors discussing this particular issue, and also perhaps looking more widely at exposing members to some of those, if you like, anonymous examples of. I actually think it would be quite a good piece of work to do, to say, I think Newport have done it, which is they've put some of the cases on the table, anonymised completely, but, the types of threshold areas that we might be looking to have to bring children in. And interestingly, members wanted to bring everything in, whereas actually the majority of those cases that they were using were people that are actually supported in the community with support around them. So I think it would be quite a good exercise, I think, to understand. I thought it was a great idea to get people to understand what that is like, because actually we hold a lot of risk in the communities, in families. That decision to bring a child into the looked after system is a difficult decision. Sometimes it's reasonably straightforward, but at other times it's a balancing act. The judiciary does play a part, but we wouldn't say it's the whole part. There are many, many drivers around the reason why our numbers are increasing. I hope that helps.
Yeah, it seems like a good idea that's been put forward then. I mean, would the suggestion, obviously this report is going to the December Council, so it would be helpful if some of the amendments that we'd suggested could be incorporated before it went there. But also there seems to be a suggestion about a member type of workshop in terms of the threshold levels for children in care, and perhaps you could consider that and then get back to us, get back to the committee on how you think that would be best to be organised. And I think the other issue is I think some of the report is good in the sense that it actually gives the figures of, for example, the number who haven't had the safeguarding training, and we would like to know exactly when we will be getting up to that 100% level and how you'll monitor different directorates to say that. But I was fortunate I was came when the inspectors came originally, and one of the questions that they asked in terms of scrutiny was that, for example, more practical examples of where the gaps are and how we're actually doing, because they raised the issue of the inspector raised the issue of, say, for example, home to school transport. How do we know that all of our bus and taxi drivers are properly trained in safeguarding? And so it would be helpful if we could have sort of some focus on, I think in some senses it would probably be better, so we're not talking about sort of naming or shaming anybody, but if you think that directorates aren't pulling their weight in particular areas of safeguarding, then and councillors, then if you could alert us to that, because in a sense that will possibly help you with your monitoring of the progress, because you can say, well, you know, this particular directorate doesn't seem to be taking it as seriously as they should do. From that point of view, you know, we would hopefully help in terms of the scrutiny progress if they were falling short. I mean, obviously there are some directorates who could be highlighted as doing a jolly good job as well. You know, you've got to be fair on this. So I hope that will summarise our points on mainly comments on improving the report before it goes to committee, and then looking at possible further workshops and you know, how we can help monitor each individual directorate to make sure they're pulling their weight on the safeguarding side. Okay, thank you. Is there anything else, Roger? I thought we had summarised everything, or have I missed something?
No, thank you, Chair. No, I think you've done very well there. Just to flag up something for Julie, will you be giving the report at the full council? Hmm?
I'm not sure. Is it Penny, or it'd be Penny that would be giving it? Obviously, we'd be there to ask.
Okay.
As far as I'm aware.
Just to flag up, some members looking at the scores we've got on table 2 will be hammering in, you know, no excellence, couple of 3s, etc., etc. And you've justified, and why? In the text why, and you've explained to us why. But I wonder if a short preamble on each one from you before you know, we get the full body of the report might be quite useful, but only if you.
Yeah, I think we've got to move on now, if that's all right. I mean, I think the point that you're making is that we had a verbal explanation about why the table on that self-assessment table was different, but it wasn't included within the report. So I think you're saying that would be useful, but I think we do need, because time's getting on, I think we do need to move on to the next report. So thank you very much, Julie, for the explanation on that report. And if we can move on to the report from on revenue and the budget side from Tyrone. Thank you.
Thanks, Chair. Today I'm taking you through the first quarter for 2019-2020 for the forecast outturn for Adult Select. It's based on month 2 data. It is a little bit late, but the last scheduled Adult Select was cancelled. That's why it's coming through today. I know we're short of time, but if I run you through some of the more salient points, if I take you to section 2, the recommendations, more notably 2.1, and that's at month 2, a forecast deficit, that's an overspend of £2.4 million for the council as a whole on its revenue budget. If I take it to section 3.2, which is the holistic revenue position, that details the £2.4 million overspend. If I take it to the social care and health line, that is, in effect, if you want to take all of the movers and shakers out of it, accounts for the £2.4 million overspend. In terms of your portfolio's Adult Select, that overspend is £186,000 for adult services. If I put that into context, as part of the budget setting process for 1920, certain directors had to make savings which were taken out of the budget. So if I take you to section 3.15, which details those savings, for social care and health, we had £1.246 million taken off our budget this year in perceived savings, of which £1.205 million related to Adult Select portfolio. So if you take that into context with the £186,000 overspend, I think that's quite a good and healthy position to be in at month 2. But I do stress month 2 because that was only 2 months into the year, and we are now embarking on month 7, and things have changed considerably in those 5 months. But we are just concentrating on month 2 at the moment. Going back to that £186,000 overspend, if I take you to Julie being the director's commentary on section 3.21. Just trying to get down to that myself. The main pressures in adult services come from our 7-view provision and pressures within the domiciliary care market. Again, that's going back to the report that Eve and Julie presented to you earlier this morning, so you're well aware of that, the pressures within the domiciliary care market. And if I then take you to our capital budget, which is detailed in section 3.23, the capital budget for Alder Select is very small. It's only got a £1.5 million budget. That's all earmarked for the new Crick Road care home development, of which at month 2 we were only expecting to spend £449,000 against it. The rest of it, we were moving our budget into 2021, which is where the bulk of the construction of that care home will happen. What we spend in this year in terms of Crick Road is around surveyors' fees, architects' fees, the preliminaries, if you like, exactly moving ahead then to formal planning consent, and then we can actually get on site to actually start the construction of the care home development. I know that's been a very quick tour of the report for you. I would like to have gone into more detail. But is there any other questions or anything else you would like me to elaborate on, please feel free to ask.
Yes, thank you very much. I mean, I think in terms of the, the overspend in a sense of 186k, I mean, in relation to the whole budget, that's probably quite a low percentage. And if you look at the other directorates, it's pretty much keeping in budget in comparison with, obviously, we've got a 2.4 million deficit. But I just wondered if there was a mention, I think, in 3.21, it says basically resulting from net staffing pressures at 7-view and pressures within domiciliary care market. I mean, the question is to make sure that, obviously, that people are getting the care that's needed, and why we've heard obviously about the pressure within the DC market, but why are we having this pressure from 7-view, and can the director say why she thinks that is?
Me too. I think one of the challenges of running a care facility, employing around 80 staff, is that there are times when people are not well or people are on training and we have to cover. So we incur cost because we don't ever not cover. And interestingly, I think must be some sort of flu going around at the moment, because last week there was an appeal for staff to go and work at 7-view because, again, they were being short-staffed. And with a staff group of 80 people, you're going to have times when there are people that are not there. But we don't ever not cover, but we obviously have to ensure that we get staff in to cover that, hence why we do incur the extra cost. It's not an area where you can say, well, we won't have that. We have to double up on the cost. So people who are not in work and are on sick leave get paid, and obviously we're paying people that are coming in to cover as well. And there isn't a budget for that. That's just how we have to run the operation when because obviously the people that we're supporting are the priority.
Yeah, the obvious question follows about that, about flu jabs and so forth, and how well that's operating. The other quick question I've got, and then I'll throw it open to the committee, is obviously we're doing quite well in terms of not overspending so much, and we've done well in the savings. But, you know, obviously we want to make sure that that's not at the expense of care in the community. And the question is what's the picture looking at roughly now? Because obviously we're on month 7.
Just to put a month 2 into context as well, the £186,000 overspend has been after taking into consideration a one-off 1-year grant from Welsh Government. Welsh Government this year has given social care £783,000 to cover specific social care pressures and sustainability, but that is only a 1-year grant. If we didn't have that grant, the overspend would be looking more like £1 million. So you've got to take that into consideration as well. In terms of month 7, overall for the Directorate, possibly looking at a position of 3.25 to 3.5 million pound over. In terms of adult, don't quote me on exact figures because we are still working on that. You're talking, even after taking into consideration the one-off grant I just mentioned, you're talking of a pressure of £500,000. The main driver within the adult portfolio is within the adult with disability services, and what we're finding is we get in younger care packages required due to older carers, and the move towards independence, the need for younger people to go to college placements as well is having an impact at month 7. Moving back to the SEMVU issue that Julie gave an explanation as well. Also within the staffing budget, there is a 2% efficiency target that's taken off every staff budget. And where you've got frontline services, that is very difficult for a manager to try and attain that 2% staff efficiency saving. So for example, they're already starting on a negative budget position. Where you have got a frontline service like SEMVU, they can't be without those staff. So how do they then attain that 2% efficiency saving? So is that difficulty as well that we need to take into context as well?
Is there anything else you'd like to add, Julie, to that?
I just think, I mean, Ty's just alluded to the emerging pressures. Just specifically around where we're feeling that pressure, a lot of older parents with adults with learning disability still living at home. It would appear that in the last 12 months or so, we've had a number of those people who are now in a position to not be able to care for the adult that they care for. And we've had a number of residential and or supported living packages that have, if you like, have come onto our books. Obviously, we're always incredibly not grateful, but, you know, when people are supporting and caring for their own, that's not a cost to us. But when they get to the position where they're not able to care for their own, that becomes a cost for us. And we have a group of older parents, particularly supporting their adults with learning disability that have ended up coming into our budget line this year. So that's, you know, we're able to pinpoint exactly where that pressure has emerged from an adult's perspective.
Questions for the committee? No. I think the main purpose of the report is to inform us of the current situation, which I think you've done, and thank you. I'm sorry you've had such a wait to do so, and thank you for your report, and thank you, Julie, for yours. So I think we'll move on to the next report, unless any other members got any other comment. Thank you. Yeah, thank you. Yeah. Do we need to quorum? Yeah. Just before you go, Roger, is everybody happy with the minutes and to confirm those? Yeah. And I think we'll defer the any forward work programme to another meeting. Okay then. Thank you all for your attendance, and thank you for the officers as well. Thank you.